Good morning, everyone, and thanks for joining us today. Today I'm joined by Tom Curtis, who's the president and CEO of St. Mary's, and I want to say a special thank you for welcoming us in today. Major General Mick McGuire, Wendy Smith-Reeve, the Deputy Director of the Arizona Department of Emergency Management and Military Affairs, and Dr. Kara Christ, Director of the Arizona Department of Health Services. Here at St. Mary's, we also have State Treasurer Kimberly Yee, Assistant Secretary Allie Bones, President and CEO of the Arizona Coyotes, Aaron Cohen, and General Manager of the Arizona Coyotes, John Chaka. We're glad to have all their help today volunteering here at St. Mary's. I'm going to give you the latest on the COVID-19 status, but before I do, I want to recognize the exemplary work that is happening all around us. St. Mary's Food Bank provides meals to families in Phoenix and 9 other counties. They operate year-round, on weekends, on holidays, during times of crisis, and during times of plenty. They are here now for the needy families in our community, and right now they need us to be there for them. Earlier this week, St. Mary's served 1,152 families in one day, the most they've ever served on a day that's not Thanksgiving. As they face higher demand, they're also facing a reduction in food donations and volunteers. Donations from grocery stores have all but ceased, and volunteers have dropped by 75%. Now, the folks here are tough. And just like the rest of us, they're going to get through this, but they need our help. If you can spare some time, come on down and volunteer. If you're looking to get out of the house, show your kids some good practices on how to give back. Come down to St. Mary's. You can go to firstfoodbank.org to sign up. And on that note, I want to thank all the volunteers at St. Mary's and at the food banks around our state. Your service is having a meaningful impact on Arizona families. I was just here the day before Thanksgiving, and Tom mentioned that the lines had never been shorter and the food had never been more plentiful. And my, how things have changed in a short period of time. Now we need food and we need volunteers. So if you're willing and able, please come on down here. I want to thank the countless people and organizations that have donated their time and resources to food banks like St. Mary's. Now to COVID-19. Combating the spread of COVID-19, it will require an all-hands-on-deck approach. And it will also require that we spare no effort while working with public health officials and leaders throughout the state to keep all Arizonans safe. That's why yesterday we took additional actions to mitigate the spread of this disease. These actions include halting all elective surgeries in our state to free up medical resources and increase hospital capacity for vital services. Updating guidance for restaurants, bars, and other businesses. As of last night, restaurants in counties with confirmed COVID-19 cases will provide dine-out options only. Gyms, movie theaters, and bars in those counties will close at close of business today. We're also delaying the expiration dates on driver's licenses, so seniors don't have to visit the MVD during a public health emergency. And we are activating the National Guard to assist grocery stores and food banks in the face of heightened demand. I want to thank General McGuire and the National Guard. The fighting women and men of America are the best in the world, and now they're going to fight this disease and the fear by getting our grocery store shelves stocked once again. We recognize these are unprecedented times. Access to food is critical. Normally it takes 2 trucks to restock a grocery store. In recent days, with the run on essentials, it's taking 12 trucks to restock a grocery store. So this is a proactive measure to ensure when you go to the store, you'll find food and essentials on the shelves. And there's no more qualified women and men to serve at a time like this than our brave service members in the Arizona National Guard, and I want them to know how grateful I am for them stepping up once again. The citizen soldiers of the National Guard have deep roots in our communities. They're Arizonans through and through, and they bring a dedication to service and helping others that few can match. They do this every time we need them, and today we need them. We don't have any illusions about this fight. We are in this for the long haul. I think it's important that people begin to think of this as a marathon and not a sprint. But the steps we have taken today and each day after will save lives and ensure we come back stronger than ever. Of that, I've never been more confident. I want to thank all of our citizens for their cooperation during this public health emergency. With all of us working together, we'll get through this, and we're going to get through it together. And with that, I want to hand it over to Dr. Kara Christ, who has been working night and day on this front to give you an update on the very latest on COVID-19. Dr. Christ?
Thank you, Governor Ducey, for your leadership and for making resources available within state government, allowing us to work together with a shared priority to protect the health of Arizona communities. And thank you to all of the volunteers and staff at St. Mary's Food Bank. I applaud your dedication and compassion to provide meals to families in several communities in Arizona. As we work together to lessen the impact of COVID-19 in Arizona, St. Mary's Food Bank has a critical role in collecting and distributing meals in our communities, especially to children who are now at home from school and are in need of food. We can all do our part to help respond to this unprecedented public health emergency, and I encourage everyone who can to donate to St. Mary's Food Bank and volunteer where our communities need it most. As service women and men answer the call to service from Governor Ducey, stepping up to stock shelves at grocery stores during unprecedented demand, and filling volunteer slots at food banks, it's a chance to reflect on the service and commitment at all levels, from our educators to our first responders to healthcare professionals who are all working around the clock to respond to this outbreak. The COVID-19 outbreak understandably is causing anxiety about the disease and how it's spreading in Arizona. Taking care of yourself, your friends, and your family can help you cope with the stress. Things like volunteering and helping your community will make your community stronger. As you know, Arizona has community spread of COVID-19. We've expected additional cases, and we know that there will be more confirmed cases as access to testing expands. There is a heightened level of risk, and because of this, Arizonans should continue to exercise precautions. As of today, we have 63 cases in 8 counties in Arizona. There are 34 cases in Maricopa County, 10 in Pinal, 8 in Pima, 5 in Coconino, 3 in Navajo, and 1 in Graham County, Santa Cruz County, and Yavapai County. We must work together toward the goal of mitigating the spread of disease to lessen the impact on people at highest risk of serious complications. Yesterday, Governor Ducey signed an executive order that will further strengthen our efforts to mitigate community spread, help us preserve our critical resources, and build capacity in our healthcare system for the days and months ahead. I'm grateful for his priority to protect the health of our communities. There are additional recommendations of steps you can take to mitigate community spread. Stay home, especially if you or a loved one have an underlying medical condition or are elderly. If someone in your household has COVID-19, everyone in the household should stay home until you are recovered. Call your medical provider to determine when you can stop isolating. Cancel or postpone events with more than 10 participants. Avoid social visits, shopping trips, and discretionary travel. Avoid being around sick people, and do not visit nursing homes or long-term care facilities unless you are there to provide critical assistance. Everyone can implement those simple prevention measures that we've been talking about for weeks. These reduce the spread of respiratory viruses. Wash your hands often with soap and water or use a hand sanitizer. Avoid touching your face with unwashed hands. Stay home when you are sick. Cover your cough or sneeze with a tissue, and clean and disinfect frequently touched objects and surfaces. These measures can help protect our communities and the vital resources within our healthcare system. While access to testing has expanded, several commercial laboratories are actively testing for COVID-19, but we continue to face a national shortage of test collection supplies and lab reagents. There are not enough tests at this time for everyone who wants to be tested. Our healthcare and public health professionals are prioritizing the limited existing testing capacity to people who are experiencing symptoms and who are at higher risk for complications. As we work with federal and commercial partners to increase testing capacity in Arizona, it's important to be clear. There is no specific treatment for this disease, and the result of a COVID-19 test will not change your clinical treatment while you are sick. People with mild symptoms should stay home when they are sick and for 72 hours after their symptoms go away. People should seek emergency care if they have extreme difficulty breathing, constant pain or pressure in their chest, severe constant dizziness, or other serious concerning or worsening symptoms. We know that many healthcare and laboratory partners are in the beginning stages of implementing screening locations, and those will become available as our supplies become available. We are working with other sites and our federal partners to continue standing up more. If you are sick with flu-like symptoms, we do expect to see more COVID-19 in Arizona, and with that, we expect to see increased hospitalizations and additional pressure on our healthcare system. Many, if not most, individuals will experience mild symptoms. To protect our healthcare system, we recommend that people with mild symptoms of the disease stay at home, get plenty of rest, drink lots of fluids, and call their healthcare provider if they have questions regarding which medications you should take to treat your symptoms. If you are ill with flu-like symptoms and need to see a doctor, please call ahead before going to see them so that they can give you instructions on how to keep other patients and our healthcare workers safe. Consider options such as your primary care provider and nearby urgent care, or consider using telemedicine where you can talk to the provider from the comfort of your own home. And most importantly, unless it's an emergency, do not go to the emergency room. Hospitals, emergency rooms, and healthcare workers need to focus on the most vulnerable patients, the elderly and those with medical complications. We need everyone to understand that in the coming weeks and months, we will see large numbers of cases and people will become critically ill. We understand how this can cause concern and anxiety in our communities, but my team and the state's public health professionals are engaged in this response 24/7. We recognize that this is a marathon and not a sprint, but we can get through this by working together. We need everybody to stay healthy, both mentally and physically, protect our vulnerable family members and neighbors, and conserve our valuable healthcare resources. We will continue to provide the public with frequent updates and advice on how to keep your loved ones safe. And of course, you can always go to our website at azhealth.gov, cdc.gov, or your local county health department to find the most recent information. I would now like to hand it over to Major General McGuire.
Good morning. Good morning to all my fellow Arizonans. Governor Ducey, thank you so much for giving me the opportunity to talk to all of you today about the role the National Guard and the Arizona Department of Emergency and Military Affairs will play in our response to this effort. I serve concurrently as the Director of the Department of Emergency and Military Affairs, as well as the Commanding General of the Arizona National Guard. That represents 8,209 soldiers, airmen, and our citizen partners, civilian partners in all 15 counties in this great state. And we stand ready today, after activating the state EOC last Friday, to call to duty a limited number of our guardsmen to immediately fill the need to sustain the supply lines to our food providers, our grocers, our food banks. The specialists we provide is logistics. We can do big scale logistics, move trucks, finish that final mile, and get things to the warehouses. But I can tell you that with only 8,000 of us, we can't stock every store in the state. So we need people to go out and get to those folks, look for opportunities for jobs, look to pivot to help in volunteer groups, non-governmental groups, and one of the most challenging things we face in a time like this is synchronizing all those efforts. And that is exactly the function of one of our subordinate elements, the State Emergency Operations Center. And I want to turn it over quickly to my Deputy Director, Wendy Smith-Reeve, who also runs our Division of Emergency Management, so that she can talk to you about how each local grocer, vendor, citizen, faith-based group, and the rest can put in requests through their counties up to the state so we can synchronize efforts effectively. Thank you.
Thank you, General McGuire. Thank you, Governor Ducey, for your continued leadership and support in this effort. Synchronizing our effort together collectively is what is going to take us to that final mile and win and support the community as holistically as possible. So as General McGuire was talking about, the logistics function and how we get resources to those in need is a bottom-up approach. Local governments coordinate with their county government, coordinate with the state, and if we cannot resource the requirement here at the state level, then we engage our federal resources to provide that support. So those that have a need within their community, it's critical that you communicate that through that chain to allow the opportunity for your local emergency manager to source the commodity that you need. If they cannot, they bump that to the county emergency management office, who is working in concert, close concert with the State Emergency Operations Center. We do coordination calls with them, we have liaisons in the field, and we are working as quickly as possible to support all of the known needs of the community. As Dr. Christ mentioned, her team, in conjunction with the Division of Emergency Management, are working to identify how we get those medical resources to the right place as quickly as possible. The chain from the federal government is slower than what we would like to see as far as the push of those supplies. However, I did get some good news today in that we are going to see a bit more commodities come in from our federal partners so we can further distribute those to the counties. Working here together today to package foods for people in our community exemplifies the strength of the whole community effort, where the private and public sectors come together to support segments of our community in need. It's not about what we can do alone, it's about what we can do together. A pandemic is something that we never wanted to confront, but rest assured that behind the scenes, state, county, local, and private sectors have been preparing for this and other situations. So the resources, information, and support they need are and will continue to be available through the time that until the time that the whole community has recovered. We applaud the residents for their resilience, and most of all, for the compassion that they are demonstrating to one another. Through social media, we've seen neighbors reaching out to others in their communities, primarily the elderly, offering to get them groceries, helping with household chores, and more, in an effort to protect them, those most vulnerable, from this disease. Such efforts personify the whole community vision. Working here together today to package foods for people in our community is a privilege and an honor. And I know that our citizen soldiers are really looking forward to the opportunity to serve in their community, and we look forward to finding other resources that come to meet the needs. Understand that not every need is met by the National Guard. They are one tool in the toolbox. They are a phenomenal resource, but we also look to garner other resources through the typical chain of supply that we have with the private sector community in order to keep our economic stable and viable. And with that, I will turn it over to St. Mary's Food Bank.
Good morning. 2 years ago, in the governor's budget, there was funding to build the infrastructure of food banks across this state. We didn't know if we were going to need that infrastructure, but I would tell you, because of that foresight of the governor, that today we have the facilities and the capacity to meet the need that is facing our state today. So with that, I want to say thank you. And additionally, with the governor here today, here packing boxes, volunteering to help feed the people in our community, and also bringing the National Guard to assist us in this process is another tool that will help us to ensure that we're able to fulfill our mission going forward. You know, as mentioned, many people are told to stay home and work from home. Our employees, our team, our volunteers cannot do that. We can't do it from home. We're a distribution business. We distribute food to people in need. And so I want to thank our volunteers. I want to thank our employees. I want to thank our donors who every day make this possible, that we're able to be here to help those in our community in this time of need. As we go forward, there'll be plenty of challenges. I am grateful that we have the support of the entire community to be able to help us fulfill our mission, and to those in our community who may need help. And many of them who are coming to our food bank at this point have never visited a food bank before, but these are different times. Our commitment to you is that we will be here for you. Thank you.
Thank you, Tom. And I just want to say once again to anybody that would like to come and volunteer, come down to St. Mary's. They've got a great team of volunteers here. They play great music. It's a lot of fun to work with these people. And we've got a lot of Arizonans that are hurting and they need help. And St. Mary's can fill the void. So if you need food, come down to St. Mary's. And if you can volunteer, please come down to St. Mary's. God bless you, Tom and Jerry and all the volunteers here at St. Mary's. We're going to be working with you through this downturn. And now we'll take some questions.
Ryan, we'll start with you. Dr. Chris, can I ask you to address how many ventilators the state of Arizona has and whether you believe that's sufficient for the number of cases we're likely to see?
So we are looking at approximately 15 to 1,800 ICU beds. We are surveying right now to identify where ventilators may be in addition to ICUs, which could include surgical, like ambulatory surgical centers, training centers, innovation centers, and we are putting in a federal request for additional ventilators.
But you don't have a number of how many are here today?
We don't have an exact number, but we're getting that right now.
Barbara Ryan. Yeah, and this question is for Wendy, completely. I'm curious throughout the process, and the demand has never been greater. Give us some idea, if you will, of manufacturers, what everything's looking like over at the growth of manufacturers. The people who create the hand sanitizer, I bet you that you've got this idea what that looks like right now.
Go ahead.
So with regard to that, yes, demand is high. And so that puts a strain because so many people are trying to resource the same commodities. So creative solutions are coming at us from many different angles. We've seen some of that, as Dr. Christ has mentioned, even on the CDC website as to how to make your own hand sanitizer. The federal government has also expressed their efforts with working with the private sector as well, and I'm sure the governor can speak more to that.
Sure. So I want to address that. Manufacturers are at top capacity. There is not a shortage of toilet paper or hand sanitizer or bottled water. This has been binge buying. This has been caused by the very real fear that is out there. It typically takes 2 trucks to restock a grocery store. Today, in this environment, it's taking 12 trucks. So I have a high confidence in our supply chain. It's going to remain wide open. This has been a discussion among all 50 governors and our federal partners. So I would say to Arizonans, please buy what you need, but you don't need to buy additional. The only thing that you would need to stock up on would be prescription drugs. That's the suggestion of public health officials. But we'll continue to replenish the toilet paper essentials that are on the shelves, and that's why we're asking the National Guard to help us with this last mile, and then hopefully we can get into a more routine cadence in terms of shopping and supply.
I want you to follow up. In this crisis, surely there's some jobs being created as a businessman. What are you hearing? I can only imagine we're getting more delivery drivers.
Barbara, you bring up a great point. Unfortunately, there are some jobs that are being destroyed through the downturn and the closings to protect public health. But there are job opportunities available. These grocery store chains, and I was just with the top 3 2 days ago to do a public service announcement, they all need to hire thousands of people to work inside the grocery store. We're working with our local food providers and restaurants to deliver food to homes. All of those jobs and opportunities are available, and I'd encourage people that are able and healthy to pursue them.
Howie, go ahead.
Hi, Governor. I know a couple of days ago you had originally said you weren't going to issue a statewide order. Obviously, that changed. We have the governors of California and New York issuing basically stay-in-place orders. And we heard you and Dr. Chris basically say if you're sick or if you don't need to be out, stay at home. Are you looking at something beyond?
No, I am not. I'm going to follow the guidance of public health. And each escalation, declaration, and executive order that I have put out has been with the guidance of Dr. Kara Christ and the Centers for Disease Control and Prevention. So if you're sick or have an underlying health condition, it's the guidance of public health that you stay home. If you're healthy, you can come to St. Mary's and volunteer.
Yeah, let me just real quick follow to that. The order talks about gyms, places like that. We have spas, we have hairdressers. Where do they fit into all this?
The order is specific, and that's what the order is today. Like I said, this is going to be with us for some time. We should think of this as a marathon, not a sprint. I have no desire to shutter something that would not protect public health. So we're going to be working in coordination and alignment. And it's not just Dr. Christ. I met with all 15 public health officers from every county in our state. From the governor's office, we're in alignment and have been through this entire crisis.
Bob and then Graham, please.
Governor, are you concerned that the legislature didn't send you the emergency funding package that they put together yesterday that would help the unemployed, that would help prevent foreclosures, that would give you the authorities to use that money for other emergency measures? And secondly, the Navajo Nation reached out to last night and said that at least some of their lawmakers that they need extra help because of an explosion of cases there. What are you doing for them?
So I want to say who I'm concerned about right now are Arizonans. Arizonans that are sick, Arizonans that are losing their jobs, Arizonans that are scared and uncertain about what's going to happen. I'm going to be working with the legislature so that we can access needed measures. Like I said before, we're going to be stretching the social safety net, and we'll be the ones doing the stretching. There's going to be a lot more to follow on the economy and what's going to happen. This entire time to date, and this week has been all about public health. Now we are going to have to deal with some of the consequences from what's happening in our economy. We realize that, and it's going to be all hands on deck throughout this weekend. So there will be more to follow, and I'm going to let Dr. Chris talk about the situation on the Navajo Nation.
And Doctor, the Navajo Nation said they have 14. You just said 3, so you could help explain that as well.
Yeah, absolutely. So our epidemiologists will be working with Navajo Nation this morning. So the Arizona residents that we have confirmed through reported testing is 3. Navajo Nation, keep in mind, spans 3 different states. So we are going to be working with them to initiate the investigation and to identify which cases are in which jurisdiction, as well as do they have other results that we don't have yet, like through IHS.
Okay, they seem to imply that they were all in the Arizona side around one community.
So yeah, so that's what we've got to identify. Did some of these lab tests go through IHS and we just don't have them yet? So we need to work on it. So that's an evolving situation, and there could be more.
Given the lack of visibility about cases all over the state because there really isn't much testing, why not expand your ban on bars, restaurants, etc., statewide now? Because it seems
Because I'm following the guidance of public health and CDC, and that's where I'm
The
going
White
to
House
stay.
guidance goes further.
Our guidance is in alignment.
Governor, are there any
Can
plans?
I ask one regarding testing testing? Dr. Chris, should people show up at ERs, and hospital, and urgent care and their doctor's offices, given the fact healthcare providers don't have nearly enough gear to cope with this?
So if you have mild symptoms of mild flu-like symptoms, and if you wouldn't have gone to your doctor's office in a previous flu season with those similar symptoms, we would recommend staying home, treating your symptoms, and getting better. If it was something that you would have previously gone to the doctor for, we recommend you call ahead and meet with your healthcare provider. There are limited tests, so we are prioritizing those for symptomatic patients and then those that are high risk.
We're going to have to go to Justin Feminelli, please.
Governor, are there any plans in Arizona to reduce the prison population? And then I had a question for Dr. Christ. How many ventilators have you requested from the government? If you want to go first, Governor.
So we're going to do every precaution necessary to protect public health, whether someone's an inmate or a citizen. We've issued the guidance. There's nothing in addition to that.
Governor. If you could, how many ventilators have you requested?
Absolutely. So we are working with FEMA and HHS to put in a request for 5,000 ventilators.
Governor, in regards to unemployment, should the benefits be extended from 26 weeks to 52?
Well, listen, there's a lot that's going to be needed to be done to help Arizona citizens. So I'm all for extensions, additional dollars. The governors were on a conference call last night talking about different packages that are happening in states around the country. Of course, we're working with our federal delegation on a bill that I believe is moving through the United States Senate and hopefully is going to be signed and become law on Monday. So, like I said, there's going to be a lot more to follow on what's going to happen for economic relief and how we use our social safety net to protect the vulnerable in the state. More to follow.
This might be directed at Dr. Chris, but why aren't you guys collecting the confirmed case numbers from different counties? We seem to see a different reporting from the state and from counties. Could you clarify that?
When counties report to the state, they've usually either initiated an investigation or it's coming through a commercial lab. So there's two different pathways. So if it's a public health high risk test that we've tested at our Arizona State Public Health Lab, that comes in through the lab, gets tested, the state health department gets notified, and then we notify our county jurisdictions. If it comes through a commercial lab, the provider gets noticed, and this is how normal, like the normal reporting when you have a disease works in Arizona. The lab reports to the healthcare provider that is taking care of that patient. Then that provider reports it to the local public health county, and then they report it to the state. And eventually the lab will report it to the state as well, so that there's kind of 2 points of contact. So the counties should know what those lab tests are. And we've got a cutoff where we will post on the next day if we get it before a certain time.
Gotcha. So just so I understand, you're saying that it's the counties do already know, but then it's the state reporting it secondary.
Yes, so we report secondary.
We'll wrap it up with
Dr. Chris, follow up on the 5,000 ventilator question.
Yes.
That's a brutal assessment from a medical doctor that the state is going to need triple the number of ventilators currently in place. It sounds like you're extremely worried about an explosion of critical cases. That means an explosion of deaths. Give us the blunt news that you as a medical professional believe we are headed towards.
Well, it's very difficult to predict what a virus is going to do in a pandemic. We are always thinking potential worst case scenario and trying to get the supplies that we need. We know that there are going to be limited supplies, so we're trying to get them into Arizona before we believe that we could reach peak capacity. And so we will continue to monitor and evaluate and either ask for reduced resources if it turns out that we don't need that many, or additional resources.
But if you think you need 5,000 ventilators, that means that in your mind, you believe we're going to have an explosion of critical cases. We are at 12 last week, 64 now. It's a math problem. We're at 20,000 in a couple of weeks, or, I mean, right?
Well, we continue to monitor. I'd hate to make predictions, but I want to make sure that we've got all of the critical resources we need.
We have one market we haven't done telling yet.
Yeah, Governor, we know for a fact that Canada and U.S., the borders they have been closed. It may be a federal decision, but Arizona, Sonora border, what plans do you have for them?
The border has not been closed. The border remains open for trade and essential services. To protect public health and the spread of COVID-19, there are precautions on both our northern and southern border. They're a federal decision. We want to do everything in alignment to protect the spread of COVID-19, but essential trade and services are going to continue. In terms of tourism, those types of elective decisions, that's all been stopped at this time.
Can you speak to our thousands of state employees, our non-essential employees being told they can work from home just as large businesses, other businesses?
Agency directors are making decisions. That's a great question. I expect public servants to serve the public. So it's Friday in Arizona. I want you to know that we'll be working all weekend on what's going to happen around public health and what's going to happen in terms of economic relief. Of course, we're making proper decisions inside the agencies. I'm leaving that to the discretion of agency heads, following the guidance of Dr. Kara Christ. But you're going to expect the people that are public servants to serve the public. That's my expectation of them. And the people that are standing behind me, Wendy Smith-Reeve, McGuire, Kara Christ, Kimberly Yee, Bill Gates, are delivering. And they're going to continue to deliver. Thanks, everybody.